My name is Erin McNeil. I grew up here in Western Kentucky with my wonderful parents, my twin sister Emily, my spunky Nana Norma, and our newest, sweetest addition, Leo. As kids, we were super active, which usually consisted of long summer days riding our bikes or fishing. Emily and I did everything together. She was a little bit of a quicker learner than me, so she became my best teacher. She taught me how to tie my shoes, swim, and swing on the swing set. She eventually taught me how to love the medical field as well. When we were juniors in high school, we were in a car accident and the airbags didn't deploy. This left me with compressed discs in my cervical spine, which made it difficult to do anything that required my hands to be above my head. I did receive a type of therapy from the chiropractic office. What they did seemed to help, but I would consistently return when the pain would come back. Emily and I were tennis doubles partners, so serving the ball became very difficult in the year that followed. It was to the point where I would have to quit mid-practice because of the pain. Having dealt with this, I became extremely interested in different medical choices that would have made this experience better than what I had. Around that same time, my Nana had knee replacement surgery. She struggled through it with blood clots. She was in a lot of pain and she wouldn't listen to her therapist and actively help in her rehab. She blamed the therapist for not healing how she wished, so seeing her struggle through that gave me a little bit of a window to see into physical therapy as well. When I came to college, I didn't have a major for the first year. I was running out of time to pick and praying that God would show me what He wanted to use me for. Random people kept telling me I should look into physical therapy, and I would say no way, nothing medical. Finally, my mom talked me into shadowing our stroke rehab floor of the hospital. I fell in love the first day, and older adults are my favorite, so for hours all I did was follow their therapy. I was pretty confident that this was something I was interested in, so I chose a major. Then my mind changed. I wasn't sure if this was something I wanted to do forever. About halfway through my exercise science program at Western, I decided to spend some of the following summer of my junior year in Haiti. There I met a 12-month-old baby named Charles. He was no more than 8 pounds and was very sick. I noticed his left arm was crippled and he was unable to feed himself or drink without help. It was kind of an experience you can't put into words, but Charles changed how I looked at my life. I knew that day how important therapy was. It was sobering to think that this child would go through life and not have the opportunity to do so many things, and I had the opportunity to gain the skills to help. I was convinced and I knew this was for me. I chose PT because of the passion it takes to care about those you're around. So with the support of my friends and family, now I'm here and so thankful for God's blessing of this journey.